Thank you very much, Desiree. As mentioned earlier, we know that the Deputy Minister is going to start getting briefed at the Civic Center, and immediately afterwards he's actually going to go to an informal settlement just behind the Tlhabane Sports Center from where we are to sort of engage the community and conscientize them about the risks of not taking care, especially when some are actually infected with TB, as we are commemorating International TB, World TB Day, that is. Well, I'm actually joined now by advocacy officer Ncumisa Panzi, who works for Lifeline, and they assist with the screening of HIV, TB and the likes. Ncumisa, thank you so much for your time. Today they are launching the 5th National Strategic Plan to tackle TB, HIV and sexually transmitted diseases. What were the shortfalls of the previous 4 national strategic plans in terms of reaching the target of ending HIV, AIDS and TB related illnesses by 2030? What do you believe were some of the challenges that you've picked up as you are working on the ground?
Okay, morning people. The challenges were the human settlement were not informed well about this TB thing. The awarenesses were not being in their places. But now I think people will be well known about this TB Wellness Day today. And then we should make sure that they know what is it that they need to do or not. But I think this strategy of them getting inside, telling people face to face, it will work, than waiting for people to go to the clinic and get to be screened there. It's totally not working that well.
Yes, and people have been saying that, come 2020, the scourge of COVID-19 actually diverted the Department of Health's attention on issues of HIV, TB and the likes. Don't you think that's part of the reason why there has been some sort of a drawback? And in fact, in 2021, there were a high number of people that actually died from this particular disease, that is TB, which is actually curable.
Yes, people have died because of the lack of information. Information is very important, and then information can be spread through churches and then schools, the settlements where people are staying. Like it's not good, the dirty there, and then obviously TB works with that one. So guys, we should do something.
But what would be your message to those that are grappling with the illness of TB, but at the same time there is a stigma that's actually preventing them from taking care of themselves, as we've heard of reports of people that actually did not take their medication and end it, and resulting in a drug-resistant TB? Okay.
What people should know is that you live for yourself. You're not living for somebody. You need to take care of yourself before you could take care of somebody. So if you see any change in your body, that means you need to consult the nearest clinic that you are, so that you can be examined for whatever the problem may be. And then in the case of people are afraid of the stigma, it's because of us people again, because we tend to judge them while we do not know what they are facing. That is why I think people, they are afraid to go to the clinic. It is because of stigma, because whenever, maybe let's make an example, if you see an HIV car, they would say you're HIV positive if it's standing near your house. That is why people, whoever who has any disease, it could be HIV or TB, they're afraid to go to the clinic because of people, because of the stigma. So people need to change so that people could attend to their health.
And the pandemic itself, that came in 2020, how did it affect your work in terms of conscientizing people to always regularly take their medications and to check up on themselves if there are any detrimental changes in their bodies, to ensure that they consult the medical personnel?
The pandemic have made a huge difference, because people have lost their jobs. They had to stay home. So there are people who are not, like, let's say, who are permanently so in the jobs, who are making smaller jobs. So they could not go outside. They could not go. Nobody wanted anyone in his house or her house because of this pandemic. So people have lost their jobs. So most of them couldn't take the medication. You cannot take a medication on an empty stomach. That one it's a big no-no.